Hello and welcome. Let's talk about vagotomy. So, what does it mean by vagotomy? The section of the vagal trunks to reduce production of the hydrochloric acid from the parietal cells in patients with peptic ulcers in the stomach or duodenum is known as vagotomy. Types: it may be truncal vagotomy, it may be selective vagotomy, it may be highly selective vagotomy, etc. Now, truncal vagotomy. It involves section of the main trunks of both vagus. It may develop post-vagotomy diarrhea because of the damage of the hepatic and celiac branches. Truncal vagotomy along with gastrojejunostomy as drainage procedure is done in case of the pyloric stenosis due to chronic duodenal ulcer and in uncomplicated duodenal ulcer with failure of the medical treatment, and when highly selective vagotomy cannot be done, then truncal vagotomy with pyloroplasty is done. Now, selective vagotomy. At present, it is not often done. Here, along with the drainage procedure, either GJ or pyloroplasty, vagotomy is done with retaining of the celiac and hepatic branches. It has got about 10% recurrence rate. Highly selective vagotomy or parietal cell vagotomy. It is done in case of an uncomplicated duodenal ulcer where medical treatment fails. This operation became the gold standard for operations of duodenal ulcer in the 1970s. Here, only fibers entering the stomach is divided both anteriorly as well as posteriorly. The complications of vagotomy. The intraoperative complications include injury to spleen, esophagus, liver, pancreas, thoracic duct and stomach, bleeding from phrenic veins, gastric vessels, perioesophageal vessels, pneumothorax, esophagogastric disconnection, early postoperative gastric atony, lesser curvature necrosis in highly selective vagotomy, and transient dysphagia may occur. The late complications include vagotomy diarrhea in about 20% of the cases, reflux esophagitis, esophageal stricture, and gallstones due to bile stasis, and gastric atony may be seen in about 50% of the cases. End of the topic.